Hi, I'm Alison from Newcastle Speech Pathology, and this week we're talking about neurodegenerative disorders and speech pathology and how speech pathologists can support with communication needs. So what is a neurodegenerative disorder? Well, look, that's any disorder where the cells of the brain are making changes that are resulting in some physical effects. So that could be anything like motor neuron disease, Parkinson's disease, Alzheimer's, Huntington's disease, a whole raft of conditions where communication and swallowing can be affected because of changes that are going on in the brain. So what do we do? Well, there's a few things that we're looking at in terms of communication. So these neurological changes in the brain can affect the way that a person actually produces their speech. So we can end up with slurred speech or very unclear speech, very uncoordinated speech. So we could have something like a dysarthria where there's a general weakness of the muscles and muscle tone that affects speech, or a dyspraxia, which means there's a motor planning and coordination issue. Of course, the other element then is language, and so changes in the brain can actually alter the way that somebody is using language. So being able to recall words, being able to put sentences together, to quickly pull out meaning from what they hear or what they read. So then the fourth thing is that it can really affect reading and writing, and fifthly, it can really affect swallowing. So all the muscles that we use for speech and the coordination that we need for speech is the same as what we need for swallowing. So when someone has got a neurodegenerative disorder and their brain is causing physical changes, we can actually see the swallowing mechanism start to deteriorate. So they're the areas that a speech pathologist gets involved in. Now, how do we help? Well, first and foremost, we really assess where a client is at to work out what their current needs are and support them in maintaining their functional skills as best they can. And then we step in with some suggestions perhaps for some AAC, so that's augmentative alternative communication. So we want to be able to ensure that our clients can keep communicating for the whole of life, and so we look at whatever systems we may need to put in place to ensure that happens. Now, these systems never occur in isolation, and we like to set them up well before they become someone's full-time communication system, so that everybody in the person's life has a chance to practice and get used to it and experience the benefits of it. And it is just there to aid and support the overall communication skills. So what could you do if you've got someone in your life with a neurodegenerative disease or disorder? Well, the first thing is make sure that they're connected to a speech pathologist. You might have just found out someone you know has a diagnosis. Well, it's never too soon to connect, because we love to support people from the moment that they have that diagnosis, because it enables us to put some great systems and supports in place really, really early on.